The racial divide in healthcare has been a focus in recent months. However, this is not new. There have been many instances of unequal, unethical, and unfair practice in healthcare for centuries. For example, in 1895, the National Medical Association was formed because blacks were not allowed to join the American Medical Association. Another example many of us know is the Tuskegee study of untreated syphilis in the Negro male. The experiment was supposed to last 6 months, with the intention to prove why syphilis treatment was so important. However, the experiment lasted 4 decades. It was not until 1972 that the study was actually stopped because it was ethically unjustified. The last example is the story of Henrietta Lacks. In 1951, she was diagnosed with cervical cancer. Her tissue sample was sent to a scientific lab. Her cells were unique because they multiplied every 20 to 24 hours, survived, and grew robustly. Therefore, studies could be done on her cells, now known as the HeLa cells. These cells led to remarkable discoveries in medicine and science, have been the foundation of multi-billion-dollar industries. Neither Mrs. Lacks nor her family ever benefited. Currently, coronavirus, which is our new battle, has changed the world. According to the CDC, some racial and ethnic minority groups are being disproportionately affected by COVID-19. As of February 2nd, Black, Hispanic, and Native Americans are 4 times more likely to be hospitalized and nearly 3 times more likely to die of COVID-19. We have more pre-existing conditions, such as high blood pressure and diabetes. Many minorities who have lowered waged essential worker jobs are more vulnerable. These include grocery store workers, housekeepers in hospitals, and daycare workers. Many of these people do not have adequate health insurance and/or paid time off. They have to make decisions daily. Do I take time off if I'm sick? Do I feed my children? Do I pay my rent? Access to the vaccine for minorities is also a barrier. It should not be surprising from these injustices of the past and our current racial climate that many people of color are hesitant about getting the COVID-19 vaccines. I was also hesitant in the beginning. I spoke to my doctors. They said since it is not a live virus, it should be okay. I prayed about it and God gave me peace. I was fully vaccinated on February 11th. I believe the vaccine saved me from getting sick when 2 of my close family members were diagnosed with COVID in March. Let me give you some encouragement about the COVID-19 vaccine. Despite the speed of development of the vaccine, the technology and science behind it is not new. Scientists have been working on coronavirus for over 7 years. COVID-19 is new, not coronavirus. The lead scientist of the coronavirus vaccine research team in the National Institute of Health is a Black woman named Kizzmekia Corbett. Dr. James Hildreth, president of Meharry Medical College, says Black scientists had a major role in the development of both vaccines. None of the steps typically involved in evaluating the safety of the vaccine were omitted. The vaccine is safe and effective. He was on the FDA board to get emergency authorization for the vaccine. Faith communities, such as Allen Temple, have done an excellent job of removing barriers to get vaccinated. I am one of the many volunteers who administer the vaccine in our community. All of us who are vaccinated should spread the word. Get vaccinated. When more of us are vaccinated, we can return to church. I can't wait until we can hug again, gather together, and praise the Lord.